We're here because there is a crisis, a health crisis, and that health crisis has prompt to a crisis care guidelines, and the care guidelines came from the state, and they were discriminatory against senior people with disabilities and people with highway. So that's what brought us here. But these times of COVID are very uncertain, and we have the basic belief that healthcare is a human right. So patients' rights are part of this also, the human right. And so we need access to healthcare and we need access to information. And one of the things to make sure that we can keep hospitals accountable to their new crisis care guidelines is to know rights and self-advocate. Unfortunately, often hospital staff themselves do not get proper training in following non-discrimination guidelines. And in that case, we can advocate for ourselves. And this is the way we do it. We equip ourselves with knowledge about our rights. So our goals for today are as follows. Make sure seniors, disabled people, and higher wage people understand their rights under COVID. Second, raise awareness of care rationing and under COVID issues affecting seniors, disabled people, and higher wage people, especially Black and Latinx communities. And the third, educate people on what rights they do not have and provide opportunities for people to take action. So with that, I'm gonna pass it to Dawson. Oh yeah, I'm Ligia Montano with Senior and Disability Action, sorry. And Dawson is my coworker. Dawson?
Thank you, Ligia. Hello everyone, my name is Dawson. I use they, them pronouns, and I'm from Senior and Disability Action. Just wanted to remind everyone of Zoom access. So 10 months into the pandemic, I'm sure everyone is more or less familiar with Zoom, but please don't forget to put your access needs, name and pronoun, and maybe the organization you're from into the chat. If you have any access needs that we need to keep in mind, please also make sure to mention. Please turn on captioning. It's on the bottom of your screen. You'll see the captioning symbol that you can click on to turn on the captions. And also, any questions, feel free to utilize the chat. We're going to be checking the chat throughout the whole meeting. So put any questions you have or comments, please, in the chat. And throughout the meeting, we'll try to keep people muted for the presentations. We'll have some time for all of us to share or ask questions as well. But for access issues, we're going to have to keep everyone muted while people are giving presentations. So I hope that's everything that we've covered. Any questions about Zoom so far? I'm sure people are pretty familiar with it. Great. So without further ado, maybe we should get started. So let me please introduce Katie Tang from San Francisco Department of Public Health. We're really excited to have you here. Maybe let me find you on my screen. There you are. There we go. Welcome.
Hi, everyone. Thanks so much for having me. And I just wanted to share up front that I know Dr. Ayana Bennett was hoping to join you all today, but apologize that she had a conflict in her schedule. So I am here today to share the latest information about vaccines, as well as speaking to some of the questions that you had raised. I'm going to try to fold in some of the responses in the presentation. And just know that this is a constantly evolving situation with vaccines. We're constantly getting new information from the state, from the federal government or the CDC. And so what I'll share with you today, just know that it is valid as of today. All right, so with that said, it's okay if I share a presentation with all of you. Oops, I apologize. It looks like I've been disabled from screen sharing.
Oh yeah, I can make it, or maybe Jessica can make Katie co-host, yes.
Sorry, try that now, Katie.
Okay, thank you. All right. And can everyone see that okay?
Yes.
Okay, great. So you can see the PowerPoint. All right. Okay. So just a brief overview of what I'll go over today, the vaccine itself, also go over the distribution process, including the pathways, the different phases, and of course, how San Francisco Department of Public Health, as well as the COVID Command Center is approaching vaccine distribution, and then share with you some of the accomplishments, challenges, and community engagement work so far. So in terms of an overview, you probably all heard this. There are currently 2 approved vaccines, Pfizer and Moderna. And the vaccine teaches our body's immune system to recognize and neutralize the virus. I have heard many questions come up about whether we are, through the vaccines, injecting COVID-19 into our bodies, and just wanted to, so that's why we have the slide here. We wanted to share that the RNA vaccine contains a synthetic version, a part of the virus's genetic codes, which teaches our body to recognize and neutralize the virus. So this particular vaccine does not contain any live virus. The other thing I'll note is that the virus has been proven through large clinical trials to be 94 to 95% effective against a person becoming ill with COVID-19. The one thing we don't know at this time, though, however, is whether someone who has received the vaccine can still transmit the virus to someone else, but at least it does protect you from becoming ill with it. The vaccine was also developed very quickly because medical experts have been working on vaccines in the coronavirus family for years. So I know that many have had questions about how is this developed so quickly, but the reality is the researchers actually didn't have to start from scratch. And then every study, every phase, and every trial was reviewed by the FDA and a safety board. And fortunately, it has been found that serious side effects are extremely rare. So I know we've all been very excited because the vaccine is a critical tool to slow down the spread of COVID-19 and ultimately end the pandemic. Most people will receive the vaccine from their healthcare or insurance provider. And in future slides that you'll see, I will explain why that is the case. But in summary, most of the healthcare providers and systems are the ones that receive the bulk of the distribution, the supplies of vaccine. At this time, we estimate that the general population will likely have access to the vaccine in later 2021. This is based on the state. They have put this on their website that they think it'll be at least fall of 2021. Currently, COVID-19 vaccines are not recommended for children. So with Pfizer, for example, only those who are 16 years old and above can take the vaccine. And with Moderna, it's ages 18 and above. However, I am aware that there are studies underway right now to examine whether there could be vaccines for children under 16 or 18. And then COVID-19 vaccines are free, in other words, covered by insurance. And as I mentioned earlier, even after being vaccinated, because we don't know enough about whether you can still transmit the virus after receiving it, you still need to wear your mask, adhere to physical distancing, and thoroughly wash your hands. If at all possible, these mitigation measures will help. And then in terms of the pathways and vaccine distribution process, I know there have been lots of questions about how it is that we get vaccines into our hands. The one thing I really want to emphasize here is that the state and federal government are driving the prioritization and allocation process. So San Francisco Department of Public Health actually doesn't get to decide who gets vaccinated first. we are actually required as a county to follow the national and state recommendations for how we prioritize and allocate the doses. San Francisco Department of Public Health in itself is responsible for allocating and administering only a portion of the vaccines that are delivered to our county. And this is an illustration of how that works. So at the far left, you'll see that in the blue box, the federal government purchases COVID-19 vaccines and then distributes them to the states, as well as pharmacies and federal entities. So if we start at the very bottom, there's an orange box called Federal Allocation to VAs. The federal government distributes directly to the VAs, including our San Francisco VA. In the middle orange box, you'll see the Federal Pharmacy Partnership. So the federal government distributes some to pharmacies such as Walgreens, CVS. I know that we are trying to work with Safeways as well. And those have gone to residents of long-term care facilities in San Francisco. So for example, this month, the residents of Laguna Honda have actually received at least their first dose, and many have received their second dose as well of the vaccine. And that was through a partnership with Walgreens. And then if we look up to the top orange box, you'll see that the state allocates through what we call multi-county entity program, as well as local health departments. And so multi-county entities are essentially systems such as Kaiser, Sutter, Dignity, and the UC system, which span multiple counties. They actually receive the majority of the vaccines that are entering into San Francisco. Then if you go below that in the lower green box, the local health departments, including San Francisco Department of Health, we get some allocation to distribute to remaining healthcare facilities, including SF General Hospital, as well as clinics that don't, clinics and hospitals that don't count as part of the multi-county entity programs. You may have heard of some of them. So for example, One Medical, Chinese Hospital, Northeast Medical Services, those are where San Francisco Department of Public Health would actually allocate vaccine to. So it's very, I hope this is clear, but this just shows that there are many pathways that really stem from the federal government and then the state, and then San Francisco DPH only gets a little bit of the vaccine. So in terms of the phases, there have been many questions about this as well. Currently, our allocation plan is based on the states, and it's a phased approach while the vaccine is in limited supply. We certainly do hope that distribution will adjust as the volume of the vaccine increases. Currently, we're in what the state is calling phase 1A. And then hopefully in the future, as large number of doses become available, we can start really rolling out the sort of high volume vaccination efforts. So in terms of the State Department of Public Health's allocation strategy within phase 1A, they're actually broken down into 3 different tiers. And as you can see in the top tier, we have the acute care, psychiatric correctional facility hospitals, skilled nursing facilities, paramedics, EMTs, and dialysis centers. Tier 2, we're looking at intermediate care facilities, home health care and in-home supportive services, community health workers, public health field staff, primary and urgent care clinics, and then tier 3, specialty care clinics, laboratory staff, dental health clinics, pharmacy staff not working at higher tiers, and mortuary service industry. Currently in San Francisco, we have been making our way through the various tiers. So tier 1, tier 2, and tier 3, and we are, based on the state's requirements, supposed to advance through each tier in chronological order, or as they have numbered it. I apologize, not chronological, but in the order that they have listed here, 1, 2, and 3. And we have to make a good faith effort in each of the tiers before we move on. And then in terms of a preview of what the state has outlined for the next phases, 1B and 1C, you can actually see here that the state just last week had even changed this such that they opened up phase 1B to say that individuals age 65 and above are eligible to receive vaccine, instead of the way that they broke it down here, which was first starting with 75-year-olds and older, and then later on advancing to 65 to 74-year-olds. However, even though the state allows for age 65 and above to qualify for receiving vaccine, it does not mean that we have enough supply though. And so that's why you've read about all the different challenges that people have had to access vaccine through their healthcare providers and so forth, because there actually just isn't enough vaccine available. So I just wanted to caution that the state announcing opening up of eligibility does not necessarily mean that someone can get it immediately. But you can see here, again, the breakdown of what the state is generally thinking. So in phase 1B would include educators, those working in childcare industry, emergency services, and food and agriculture, such as grocery store workers. And then next would get into transportation and infrastructure, and those living in congregate settings with outbreak risk, including those who are incarcerated and homeless. And then phase 1C, we get to individuals 50 to 64 years of age, and people who have an underlying health condition or disability which increases their risk of severe COVID-19 from the age range of 16 to 49. And I did have a chance to hear from the Mayor's Disability Council this week, last week, I apologize, and have certainly heard concerns around why individuals with underlying health conditions or disability are part of phase 1C. I totally understand the concerns. This is, again, I'm laying out what the state has adopted as its framework and which we are required to follow. Below is a website that the state has, which will continue to have updated information about the phases. And I would not be surprised if the state continues to change and move things around. One thing I'll also note is that the state has not been very descriptive about what all of these different categories, like how they are defined. We at SFDPH are also not endeavoring to further define. We think if you feel that you qualify for one of these categories, then please do try to seek a vaccine, especially once it's available. Now, in terms of distribution strategy and process, I wanted to share some of our guiding principles, which is grounded in equity, speed, and partnerships. We want to ensure the capacity to fully use the vaccine supply that is provided to us from the state. We want to ensure equitable vaccine allocation and administration to all of our broad communities and really prioritize the vaccine access in communities with highest COVID prevalence, including among those who do not access healthcare. We want to make sure that all the information is transparent and visible to the public, and our website is constantly being updated, including today, just launched a dashboard, which will again continue to be refined and built upon, that shows how much vaccine is being distributed to San Francisco residents. And then to every extent possible, we want to preserve our Department of Public Health staff for functions that only DPH can provide. So our partnership with our health systems is essential. But DPH, as you know, as part of the health network, really tries to ensure that there is vaccine access even for those who are not insured. And so this is kind of a similar summary of what I stated earlier, so I'm going to skip through that slide. In terms of our strategy for vaccine distribution, so as I mentioned, first of all, we do want to ask individuals to go to their health provider first, if possible. But if not, San Francisco is preparing its infrastructure to administer more vaccines once the supply is available. And that's really key. We are setting up the groundwork, but we don't have enough vaccine right now. However, it doesn't mean we can't plan. And so in terms of the strategies, there are high volume vaccination sites, which I'm sure you heard the mayor announce this week, as well as community-based points of distribution. So that could mean through mobile situation, through hubs, through clinics, and then also partnership with pharmacies. So in terms of accomplishments, challenges, and engagement, we are well underway in protecting the most medically vulnerable populations. As of January 10th, and I apologize, I don't have the latest information right now, but it should be on the dashboard. I just didn't have time to put it in this presentation, but over 18,000 residents have been vaccinated, and of those, almost 2,000 have received their second dose. Vaccinations have started in long-term care facilities through the CDC partnership with the long-term care program. So all residents of Laguna Honda Hospital, as I mentioned earlier, have been offered a first dose of vaccine. And as of January 10th, 2021, 13 of the 18 skilled nursing homes have had their residents offered vaccine. So in terms of some of the challenges that we are experiencing, as you know, there's no unified federal or state system for vaccine delivery. In fact, it's unclear to San Francisco and other counties how much vaccine will be allotted and when, and the guidelines keep changing. So for example, last week, we thought we would receive 10,000 doses of vaccine, but only received 2,000. Or sometimes our teams will receive calls that they'll all of a sudden get dropped, 1,000 or so vaccines, and we need to figure out how to allocate and distribute them. It's just, we can't even do short-term planning because there's no consistency in how much vaccine we get and when. In terms of data challenges, people always ask, okay, how many people have you vaccinated? How many have you used? How many have you received? And all the information and reporting is supposed to be done upwards to the state by each county. And then the state is supposed to share all that data with us to each of the counties. However, I know the state is still in the process of getting their data systems up and running. And so as you can imagine, there's a lot more transparency and information that we would like to see as well from the state that we aren't getting at this very moment, but I know we are on our way there. In terms of operational challenges, we have to quickly operationalize a collaborative of all major health providers to create new operations that scale up to 10,000 vaccinations per day. And so as the mayor had announced last week, really trying to help to stand up these high volume sites. But of course, it will take quite a bit of work as well as more vaccine to really get those up and running. In terms of community engagement, this is really key to our vaccination effort. We are planning to use and are using multiple channels of communication to try to provide transparent and clear information to all communities. And I'd love to hear from all of you if there are other ways that you feel that we are not sufficiently getting information across. I'd love to figure out how we can address those needs and gaps. There was a question about whether San Francisco, like other counties, is standing up a task force for vaccines. And yes, we are. Although we are already working with multiple community organizations and groups, and have been throughout the entire pandemic, there is a formal task force that will also be started that all other counties are engaged in. So we haven't finalized that group listing, but I assure you that we are looking at it closely to make sure that all the individuals and members represent a diverse and broad coalition of communities in San Francisco. And then as key messengers for the vaccine, we hope that you'll help us share information with your communities as well. But of course, if you have questions, let us know. In promoting vaccine safety and efficacy, encouraging vaccination once it's available. And, sadly, we still have to promote prevention activities, staying at home, wearing a mask, physical distancing, and washing your hands, as not everyone will receive the vaccine at the same time. And so we still need to take precautions. And of course, we want to know what you're hearing from the community. So actually today, I'd really love to hear more from you about what you're hearing and what your concerns are. And I have received some of the questions beforehand as well. So these are links to 2 websites with more information, both locally from San Francisco and as well as the state. And just want to thank you for your time, and happy to listen to anything you want to share with me so that I can bring it back to the vaccine team. Thanks so much.
Great, thank you very much, Katie. You said that you have received the questions that we have sent you before. So just wanted to maybe start with, I think we can combine question 1 and 2. How is the city planning to get large numbers of people vaccinated as soon as possible? You mentioned briefly about the operational challenges in trying to get up to 10,000 vaccinations per day. So what's the actual plan in getting there? And what's the plan to prioritize seniors and people with disabilities in that process?
So I did mention pieces of this in the presentation, but I think what I'll restate is that we are currently, as the mayor announced last week, really trying to prepare the infrastructure for the high volume sites, but we don't have enough vaccine right now, right? So it's setting up sites like I think she announced, City College, for example, but then also getting into the communities where there are high needs and have been most impacted by the pandemic so far. And we have data to show us where those locations are. And so that's how we're planning all that infrastructure at the moment and partnering with the wonderful community organizations that have already been doing, for example, COVID-19 testing in our communities, right? And then in terms of prioritizing, you saw the different phases. So we don't have control over that, unfortunately. We must go in the order that the state has indicated we must. I will note that you may see other counties moving faster than others, and that's because we have different population size, different demographics, right? So for example, in phase 1A alone, San Francisco has an estimated 80,000 to 100,000 people. That's not only residents, but it also includes the people who work here. And we have a huge healthcare workforce in San Francisco. So you will see other counties moving at different paces, but it doesn't necessarily mean that we are sitting on vaccines or anything like that. We don't all even get the same number of vaccines either. So, so I just wanted to put that out there for you as you're hearing things in the news.
Thank you. I think a big concern among seniors and people with disabilities is while having specific sites in different neighborhoods in San Francisco is helpful, a lot of people cannot really even leave the house. So a big question is, if people are above, let's say, 75 years old, and they live alone and cannot really leave their house, but they are part of phase 1A, the question is, what is San Francisco doing to provide vaccines for people who cannot leave?
That's a great question. And I know that our vaccine team is currently planning for this. They don't have a system in place at this moment, but they are planning for a mobile team, mobile vaccination unit that includes paramedics and nurses. And we're very interested to partner with home health organizations or people with experience with working with homebound individuals to figure out what is the best way to roll that out. But certainly the vaccine team is looking into it.
Thank you. Yeah, another question that we had was if long-term care facilities, this is pretty quick, include assisted living in adult day care centers?
I do believe so. I'm not sure how the state actually breaks it down. I apologize. I know you had a question about both nursing homes, assisted living, and IHSS workers as well. And so I only know so far in terms of our nursing homes in particular, and I think I mentioned this in the presentation as well, that 13 out of 18 nursing homes as of January 10th in our county have received, the residents have received an offer vaccine, and the workers were of course covered under phase 1A as well. In terms of the IHSS workers, that's an ongoing effort right now. I know that they're making their way down the list, so it changes probably every day. So I can't give you a number right now, but that's an ongoing effort that's currently happening.
Thank you. I'm just going to try to work through these questions. Yeah, another concern was for people who are over 65 but may not have health insurance, how people can access or even ask for vaccines in that case.
Mm-hmm. We certainly want to hear from you if you don't have access to a health insurance or health provider. And that's what the San Francisco Health Network is for, is really to help those who don't have access otherwise. So again, that's part of the San Francisco Health Network.
Okay. A lot of people in the chat are also generally kind of concerned about negative news about Moderna vaccine. Would you care to briefly talk about that?
Sure. We have heard of some limited cases down in Southern California about Moderna. So as soon as we heard about the situation in San Diego, we were contacted by the state just to let us know what had occurred. Again, there were few, it was not a mass situation. And so we have in San Francisco also notified the different partnering entities that have received that particular lot of vaccine, and have contacted them, out of an abundance of caution. We should hold on the particular Moderna vaccines that were from that specific lot that was distributed and pause for now. until there's further study or research done to show whether we should halt it or not, but it's the pause at the moment. We have not heard of anything happening in San Francisco yet from the people who have received that particular Moderna vaccine. And of course, we'll monitor that situation, but that has set us back though, unfortunately, because we had to cancel appointments and so forth because of the holding back the Moderna supply for now.
Right. Thank you. Hope that answers some questions in the chat. We also have a question about 5150s or 5250s. So people who are detained under 5150 or 5250, could they or should they be getting the vaccine if they go into an acute care facility?
You know, I don't know at the moment how that's specifically handled. So I will jot this down. I don't want to give you a wrong answer. So let me note that.
Thank you. This next question might also be one for that. Do you happen to know if there are any reports of caregivers or IHSS workers or any of the, I guess, like tiered workers who are denying to receive the vaccine when they're offered?
That's, you know, I think it really depends. So certainly we've heard of health systems not being able to offer vaccines because they don't have enough supply, right? You've definitely read about that in the news, especially when it came to the 65 years and older population, right? So, you know, we have certainly heard of healthcare providers turning people away due to the limited supply. But in terms of San Francisco County, we've been trying very hard to get them access. If we hear about it, we try very hard to advocate or to try to figure out a way to get you into some sort of clinic to get the vaccine.
Thank you. So 2 more questions I have for you. You did briefly mention that there's a plan of setting up an advisory committee and that you're trying to make it diverse. I guess the question is, what is the plan for SFDPH to make sure that disability and senior and higher weight people contingent is represented?
Mm-hmm. Yes, so I have already advocated for someone from both Senior Disability Action as well as Mayor's Office of Disabilities to be a part of that. So again, the list has not been finalized, and I know that there have been others whose names are on the sort of tentative list as well, who represent the senior and disability community. So I will make sure to circle back once hopefully we get a little bit more clarity on that task force, but absolutely we have to include all the voices.
Yeah, thank you. And want to highlight that we do advocate for higher weight people as well to be represented. And lastly, but not least, just switching gears a little bit towards crisis care, just want to make sure, how do aging, disabled, and higher weight communities know that health providers will not deny treatment based on assumption about our quality of life with all the crisis care guidelines? Yeah.
That's probably one I'll have to follow up on as well. Let me, I wanted to try to look in, if you wouldn't mind just repeating the question one more time.
Of course. So how do aging, disabled, and higher weight communities know that health providers will not deny treatment based on assumptions about quality of life, which has been done in New York or Italy? The care rationing for COVID-19 has been executed. So how do we know that hospitals will not discriminate against us? Especially given the new crisis care guidelines from California.
So, I mean, I'd actually be curious. Has anyone who's participating here today, like, do you have personal stories or situations that people would be willing to share? And feel free to put in the chat if need be, but I am curious to hear specifically what has actually been going on so I can look into it further.
For example, my girlfriend is 80 years old, Asian, and hasn't even heard anything from her provider about vaccine. But Dean Martin, 75, got a vaccine and he said, "Thank you, science." So how would you see that?
I see what you're saying. And it's, again, due to the limited supply, different people in different systems will get vaccinated at different times. I'm not sure that that's necessarily a system being discriminatory, right? But for example, you know, I'm a Kaiser member, and I know that even though the state had said they would roll out eligibility for 65 and older, just this weekend they said, sorry, we're actually going to have to start with 75 and older because we don't have enough supply, right? That's Kaiser. And then Sutter, I had heard, you know, they had issues too when the 65 and older became eligible. They just didn't have the capacity to be able to handle that. And so, you know, again, everyone belongs to a different system and will experience receipt or information from their health provider in different cadences. Some are better than others, right? So, but I can't say that that's the hospital discriminating against people. It's just we're in this place where we don't have enough. And I think once we have more supply and it's flowing better, we won't see these situations where we have to do so much of the gating, right? And the criteria.
Because of the challenges are so and the volume. Since I'm a low risk person, I think I will get it around July or August. And then another expert was saying that this vaccination is going to be annual type. It's not because mutation. And so I said, oh, I was just thinking, then I'm going to get late, but you know, the new will not be, the effectiveness will not be that good. So why should I get the first batch of maybe when the second batch of new vaccine, then I will try to get it.
Right.
Well, so at this moment, Moderna and Pfizer vaccines, again, have been shown to have quite high efficacy, so around 95%. And so I understand personal concerns or wanting to wait till later, but so far these two have shown really great efficacy rates. And I think you had a question about kind of the new strain and the mutation as well. We don't have enough information right now to indicate conclusively whether the vaccine is will be less protective or not. We don't know that at the moment. So certainly we don't want rumors spreading around.
Yeah, one funny thing about it, even within the family, the relatives,
Sylvia, I think we're gonna try to, Sylvia, sorry, I think we're gonna try to give space for other people to ask questions. Thank you so much for participating. So we do have a question about how San Francisco SFDPH or hospitals are going to try to advocate for disabled people and higher weight people if the again we have a surge, and again so right now maybe it's not as scary, but it could be that we have a surge again, and even if we have the crisis care guidelines, we have people in the chat reporting that disabled people and higher weight people have been reducing the care that they're getting because of the COVID. So they have not been even like being able to go to the hospitals. So the whole access to care issue is really high. You cannot pause your disability during COVID. You cannot pause your senior status during COVID. You have to get consistent medical care if you need to, but people have been struggling. So we're still ways from equitable medical health care. So what are hospitals and SFDPH trying to do to make sure to close that gap in equity?
Yeah, and I think that the bigger picture for our San Francisco DPH is really making sure that first of all, we maintain our hospital capacity. And actually, when you compare us to the rest of the Bay Area counties, we are doing significantly better in terms of, you know, you might wonder, okay, why is it important for us to keep our ICU beds down low? What does that mean for the everyday person who needs to go get care, right? And really, a lot of it has to do with staffing. And so the lower our hospitalizations, the lower our ICU need is, the more that we have staff and medical professionals to assist people with the everyday care that they need, right? So that has been huge priority for San Francisco, and I'm sure other counties as well. But that's also why we have been a little bit more stringent when it comes to certain reopening criteria for businesses and so forth is because we're really trying to keep, again, our hospitalizations and our case numbers and all of that down low, so that people who need care, like even my parents, they can't go, it's hard for them to go to the doctor's office physically right now, right? But we want to be able to allow people to get the care they need, and it's part of the bigger strategy. So I hope that answers the question, but that's our approach. It's we have to drive all the numbers down so that people can get the access they need.
Awesome. This is Brandy. Can I say something?
Mm-hmm.
Hi. Yeah, thank you for your response. So as Dawson was kind of indicating, as I said, my name is Brandy. I'm with Nobody is Disposable, as well as Fat Legal Advocacy, Rights and Education Project, and Independent Living Resource Center, San Francisco. I'm an attorney, and I wanted to thank you for all of your information that you have given so far. But I did want to point out that Nobody is Disposable Coalition has actually been compiling stories. We have over close to 500 responses of people who have chronic conditions and need crucial medical care and have been putting off that medical care for almost a year because they are scared of going to the hospital and getting COVID and being at really high risk of serious complications from COVID, but then being low on the priority list to receive care should there be some sort of crisis care situation that comes up. And so this is really a problem when you have individuals that are putting off cancer treatment or testing for cancer or physical therapy that are things that are going to impact them forever possibly, and that they're not going to be able to possibly come back from or get back to where they were a year ago. But they still have to wait, and they still have to be in category like 1C, along with tech workers and other individuals. And it's really, really disheartening when this happens. And then things happen like the state says, oh, well, all veterinarians need to be vaccinated. I love my animals a lot, but at the same time, basically the state message is animals should receive medical care, but people with chronic conditions that could die waiting for the vaccine need to wait until August to receive medical care because they can't get the vaccine and it's too dangerous for them to go into a hospital situation or any sort of medical setting. Many of these people have actually been, not leaving their homes since March because they've seen the guidelines and the crisis care guidelines and all of that with, all the scoring systems and determining who's going to be priority to get medical care should they get COVID and should there be a shortage situation. So with that, I just want to say that we have created a survey. As I said, we have over 500 responses. We plan on sharing these responses with counties and states just to show people what's happening and the importance of these people being able to, people with chronic conditions or people that need care need to be moved up to category 1A or at the least 1B. But keeping people in this situation in category 1C is unacceptable and unequitable and wrong for so many reasons. Thank you.
Thank you for sharing that.
And I did also want to say that, as I said, I am an attorney. I'm with Fat Legal Advocacy, Rights and Education Project. And I do want to volunteer to be on your board. One in every 4 Americans are higher weight individuals. And I really feel like higher weight never gets represented on boards and things of this nature. And so just so you know, I'm available. Jessica has my contact information. You can reach me at brandy@ilrcsf.org. My name is Brandie, and I can put that information in the chat as well. But yes, I would like to volunteer to be on the committee because I believe that higher weight individuals need to be represented on all task forces regarding the vaccine and other things. And specifically in San Francisco, where there's actually an ordinance that makes it illegal to discriminate based on someone's weight, their height. And so, yes, I'm volunteering.
Thank you, Brandy.
You're welcome.
Thank you. And we do have one hand from Maya Scott Chung. I just wanted to give them space, and maybe we can go to the next speaker after that. Thank you so much, Katie. Maya?
Sure, can you hear me? Yeah, I'm sorry, I'm having some trouble with my keyboard, so I couldn't chat it. And thank you, this is such a really, really helpful and necessary conversation. My family lives at a lot of the intersections that we're talking about right now. We live in Oakland. I am a higher weight individual with chronic conditions that I have two different, I'm a
I think we might have. Uh-oh.
Maya? Give a couple seconds, and if it...
for 3 months
There
at
you are.
least. Oh, can you not hear me?
Sorry, we missed maybe a minute or two of what you just said.
Oh, I'm sorry. I don't have very good internet either. Well, we're a working class family with 3 out of 4 of us on disability, ages 16 to 86. We're also a trans and queer family. We're a multiracial family. We're a multilingual family. We're low income. My daughter is in school, and we are concerned about her going back into school for herself because she has type 1 diabetes, and also because she's got an 86-year-old and 2 disabled parents at home. So I think that one thing I want to have just a real recognition of is that when we're living in households with other people, we are all putting each other at risk if we don't have access to vaccination. And it's 3 out of 4 of us are in school as well. And my husband has low platelets and is transgender, and we're very concerned about the story of the doctor who died from low platelets from a condition that is exactly the one he has, actually. So there's also questions about being able to vaccinate most of a family to protect those of us who may not be safe to get the vaccine at the same time. So mostly that's not, I just wanted to kind of make visible some of the invisible folks who have multiple generations, and 100% agree that higher weight individuals, some of us who are fine about calling ourselves fat, we almost never get discussed in this. And the intersections of chronic and acute conditions make us much, much more likely to have care rationing and inappropriate and discriminatory care as well, especially if we're people of color, low income, disabled already, like this. So thank you, and really, really grateful for this forum.
Thank you, Maya.
Thank you for sharing, Maya. And thank you very much for Katie for being here, and to the whole SFTPH. I'm going to pass the mic over to Ligia. Thank you.
Hi, everybody. Hi again. This is very good. It's great that we are having all this conversation with the information that we need, but also with the experiences of our people, our community. So next we're gonna have Richard Santana, and Richard Santana will share his perspective on the COVID pandemic as the DPH, the Department of Public Health worker, but also the impact of COVID on Black and Latinx communities. And I want to say, this is why we need Medicare for all, guys. So Sin nada más que agregar, les dejo a Richard Santana. Sin agregar nada más, without adding anything else, I'm going to leave Richard Santana with all of you.
Hi, everyone. So when I was first asked about my experience, I knew it was a personal responsibility and also a community responsibility to say yes. And I want to first approach about a lot of Black and Brown people in our community have distrust, but I want to change that rhetoric. I want to say that it's a reaction from how health outcomes have been different for Black and Brown people. So it doesn't come from out of the air, doesn't come from nowhere. It really comes from our experience. I know that when I was first asked to take the vaccination, I had a little apprehension. You know, being a first generation mainland American, my family are from Puerto Rico, but I'm the first one that was born in New York City. And in the 60s, there was a study done to create oral contraceptives. And a lot of the Puerto Rican women were given hysterectomies. A lot of them were given different doses of birth control, and they developed cancer. And so there was distrust in that community because of how we were treated. And that's because there was an informed consent. Also, with our Black brothers in Tuskegee, Tennessee, back in 1932, they did a study out of 600 African American men, 399 of them had syphilis, and they were not treated because they wanted to see the progression of the disease. Once again, that doesn't build trust. So when people say that they're not trustful about the vaccination, I totally get it. But I know when I received my vaccination, I had informed consent. These individuals before us didn't have informed consent for those studies, but now we have strict guidelines that are out there to protect us. And I'm speaking to everyone, but I also want the Black and Brown people to hear, because it's very important. We all need to get vaccinated. You know, when it comes to COVID-19, in California, the Latino population has been adversely affected, and it's been impacted in such a different way. We have almost 3 million cases now in California of COVID. And out of that, 56% of them are Latinx, and those who have died, 48% of them are Latinx. So you can see the importance about trying to make sure that we have more trust in the community so we can get these vaccines into people's arms. You know, people feel sometimes, for whatever reason, they may not want to have the vaccination, but you do it for yourself, you do it for your family, you do it for your colleague, you do it for the person down the street, and you do it for your community. The only way that we're going to actually really have any type of control over COVID-19 is to get people vaccinated, and also for people to get their care when they need it immediately. One of the things that I know that have been going around is a lot of these conspiracy theories. People get online and they see different things surrounding the vaccination. I know when I took the first shot, my arm was completely sore. The second shot, 21 days later, wasn't so bad, but the risk of dying or me passing it to somebody and somebody else dying was not, it was no game for me. I definitely said to myself, I'm definitely going to do this vaccination. One of the things that I'm seeing in communities now, because I'm deployed into shelter health, I'm a shelter health nurse already, but I'm deployed into the community. So now my community has shifted from being in congregate settings into hotels. And these hotels are not really built to house people in long-term settings. They're not negative pressure rooms, they're not positive pressure rooms. You know, there's also areas like single room occupancies. These are hotbed of actions that people could actually transfer the virus. So it's very important for individuals living in those communities to also get the vaccinations. And I want to speak to our audience too. If you're homebound, you still need to get that vaccination. Because when you're receiving care for somebody who's coming into your home, you're receiving them along with whoever they touch the community too as well. So don't think that just because you're at home that you're safe. It's important to get vaccinated. And it's also important to advocate for yourself. It's important to understand what the tiers are. They are ever changing, but now that we have the website that was listed here, it's important for you to look out. You know, one of the things that are really scary and sad is because of COVID and everybody having to pivot, not many people have laptops, not many people have iPads, not many people have a smartphone. So just imagine you're disabled, you're a person of color, and then if you don't have these modalities to have communication, then you're already been diminished before, and this even makes even a darker outlook for you. So if you're being asked for the vaccination to take it, always say yes. Please know that you're not just doing it for yourself. Like I said before, and I can't say enough, you're doing it for yourself, but you're also doing it for your partners, you're doing it for your friends, you're doing it for your community, you're doing it for your family. It's not a hard vaccination. People have soreness in arms. There has been some people have had different side effects, but they're pretty truly rare. When you think about the whole globe is getting this vaccination and only a handful have received, put in perspective, only a handful of people have really had bad reactions compared to all the people who have received the vaccinations in their arms. One of the things that I hope that people will leave from this conference is that they go and speak about the conference, that they maybe will have more information that they had when they first signed into this conference, and to know that, you know, this is highly regulated. You know, San Francisco's doing a great job. We've only had almost 300 deaths, but also in relation to how many people we have in the city, it's still truly concerning. You know, the only way that you're not going to get this this disease is, yes, to social distance, wash your hands, wear an N95. If you have to wear one of those cloths, then wear a surgical mat underneath it as well. But also, if you're given the opportunity to take the vaccination, please say yes to the vaccination. I don't know if I said that enough. I hope I impressed upon to everybody. The one side effect I did have was confidence that I was doing the right thing. And that allowed me also to feel a little bit lighter in my feet after that, especially when I got the second one. I felt we can do this. But also, I also knew that I still needed to wear my mask, because just because I'm vaccinated doesn't mean that it's not something brewing in my nose and that they're replicating. And if I sneeze, I give it to somebody else. Yes, I might not be affected. I may not even know that I had it because I got the vaccination, but you can still pass it. So until we can get at least 90% people vaccinated, we'll still really end this together. So I'm going to say it one more time. If you're being asked yes or no, do you want the vaccination? Please say yes. And that's my experience. So, and if anybody has questions, I'm more than happy to answer some.
Thank you, Richard. That's great. I was going to ask you, someone in the chat put that her dad is going to get the vaccine shot at home. And do you know, I'm not sure if that is happening in San Francisco. Do you know if there are any people that you have contact with that are getting the vaccine in their homes? You know, for those people that are homebound.
Right now, I'm sure there's a lot of task force that are going to do vaccination at home. As far as when it comes to the congregate livings and the hotels, in the next couple of weeks, they're considered their homes now. So we're going to go into their rooms and give their vaccination as well. But if you're in your own home and you're getting a vaccination, I want you to be your own advocate. Okay, you can be your best advocate. So whoever's giving you that vaccination needs to hang out with you for 15 minutes to 30 minutes, because that's when a reaction can happen. You know, talk about the weather, talk about, you know, your plans in the future when the pandemic's gone. But if you do receive the vaccination at home, someone should stay watching you for 15 minutes to 30 minutes at least, because if there is a reaction, then that's when it will happen.
That's great. Thank you. I mean, this is really, really good. The other thing that I was gonna say is that is it's really great that you have mentioned the history, because we don't know that kind of stuff, that happens in other places unless someone tells us, because that's not in our history books. So thank you so much for bringing that part of the history, even though it's not a great experience that happened in Puerto Rico. It happens in other countries too. But it's good that we learn from that. And yeah, so thank you so much. Is there anybody else that would like to ask anything?
I
To
see one question. I think the question was, is the
Oh,
KN95 as good as the N95? So if you think of N95, and I'm going to be a little old school here, as the Cadillac, you should definitely get that. Now the KN95 is still good because it still filters out particulates. And since you're not in a hospital setting, I would say that's cool. But if you're going to be in a hospital setting, you're dealing with patients, then you definitely want the Cadillac, which is N95. That's who I believe Marie who asked.
all right.
I also want to say thank you to Maria Guyan, and I also want to say hello to Andy Rice, who's a colleague of mine. I think she's somewhere here as well. I know that when, one of the things that I'm nervous about is because when you do get the vaccination, you feel kind of empowered. But also, I want to remind people too that you still have to wear your mask when you have your vaccination, because it doesn't mean that you can't still transfer it to somebody else as well.
Oh, Richard, there is a question on the chat and said, are all people getting vaccines having to wait the 30 minutes afterwards to see about reactions?
Yes, I know that when I received my vaccination in San Francisco General Hospital, we were asked to wait 15 to 30 minutes after the vaccination. So I'm unsure how they're going to do that when they do the mass vaccinations. But yes, it's prudent to make sure that you're in an area that you can receive medical attention should you need it, especially if you're somebody who's highly allergic to a lot of things as well. And they're saying that pretty much everybody should be taking it, even if you have some type of allergies as well. The benefits really outweigh the risk. The risk is death, so really should say yes.
There's another question. Let me see. Is there a possibility that they will be distributing vaccine in retirement communities, especially ones with dementia, Alzheimer? I think it was answered by Katie Shan already that, yeah, they are doing that. Okay, I think that we got all the information that we needed from you and all the great energy. Thank you.
Oh,
thank you for your energy. Thank you so much. And Dasam, you're next.
Thank you again, Richard. Thank you. Here.
Some Eileen Greco had her hand up.
Thank you. Eileen, would you like to come on?
You're on mute, Eileen.
Sorry, can you hear me now?
Yes.
Yes, you talked about a reaction, and that's my fear. And I wondered, what do you do if you do have a reaction? What are they going to do for me? I mean, to stop the reaction, if I have one.
I mean, what I've heard,
Oh, sorry.
That's okay. What I've heard, there's been different reactions. So if it's an anaphylactic reaction, you definitely want to make sure that you're with medical staff so they can clear an airway. That's the most important thing when we think of reaction, anaphylaxis. Any other reactions, it depends on how severe it is. Somebody can give you an EpiPen or even some Benadryl. So it could be mild to something. I know that a colleague of mine, her second dose, she developed a little bit of a rash and she had Benadryl given to her and she was fine. The most reactions that we're concerned in is that when it affects your respiratory. When you get an anaphylactic reaction and your airway closes, you need artificial intervention in order to create that oxygen airway. So that's why we say to stay within 15 to 30 minutes, because they have all that equipment there.
Okay.
It's
Very
not like
good.
you're going to go home and then have a reaction days later. That would not happen to you. If it happens, it would happen to you within 30 minutes. That's the window.
Thank you so much for this. And now, yes, we are moving to the next speaker now. Thank you so much, Richard.
Do they take the vital signs before?
Okay, Sylvia, at this point, we really need to go to the next speaker. So put anything on the chat and we can try to get.
Vital signs, I mean.
Let me find Brandy. Yeah, let me welcome Brandy, please. We just heard a little bit earlier from Brandy, but our next speaker. No body is disposable.
Hi again, everyone. Again, my name is Brandy Senziak. I'm an attorney. I'm with FAT Legal Advocacy Rights and Education Project. I'm also an attorney at Independent Living Resource Center, San Francisco, and I'm with the #NobodyIsDisposable Coalition. So Independent Living Resource Center San Francisco is a disability rights advocacy and support organization. We work to empower individuals and community so that all people with disabilities have a full and productive and independent lives as they so choose. FAT Legal Advocacy Rights and Education Project is creating justice for higher weight people of diverse backgrounds. The FAT Legal Advocacy Rights and Education Project is committed to centering the needs and lived experiences of people of color, super fat people, and disabled people in fat justice work. So I was asked by Jessica to first talk a little bit about crisis care. So during COVID, hospitals may not have enough staff or beds or supplies or equipment to help everybody who needs help. And when this happens, doctors are being asked to make decisions of who gets help and who gets care. So far during the pandemic, most of our hospitals have not had to move to a crisis care model. However, in case hospitals start having to move to a crisis care model because there's not enough resources for individuals, California has put out guidelines of what hospitals should do. On June 9th, 2020, California put up a document that tells hospitals how to plan for shortages of beds and supplies. Before this document was put out, California had published another document that would have resulted in discriminatory treatment for older people, higher weight people, and people with certain disabilities. Myself, along with several other disability, aging, and weight justice organizations, worked together with the state of California and other advisors to come up with a new document. And the new document that was come up with is what you will see if you go to the California Department of Public Health's website. And you can just Google California Department of Public Health Crisis Care Guidelines, and you will see the current document. One of the key points, which I'm very proud of, that is in that document, lists that healthcare decisions, including allocation of scarce resources, cannot be based on age, race, disability, including weight-related disabilities and chronic medical conditions, gender, sexual orientation, gender identity, ethnicity, including national origin and language spoken, ability to pay, weight, size, social economic status, insurance status, perceived self-worth, perceived quality of life, immigration status, incarceration status, homelessness, or past or future use of resources. And so, as I said, these guidelines can be found on the California Department of Public Health's website. However, the California guidelines are just that, they're guidelines. So each hospital actually can come up with their own crisis care policy. Many of these policies have been very hard to find. And so finally, California required hospitals to post their crisis care policies as of January 6, 2021. Some of these policies are still hard to find. So if you're looking for the policy that is for whatever hospital you may go to in case of COVID, you can go to the hospital's website first. If that doesn't work, you can call the hospital and ask where their policy is posted. If you're still unable to get an answer or find a policy, you can call the California Department of Public Health. They do have some policy, a lot of policies have been emailed to them, so they do have some of those policies. And if you're still not able to get access to the policy, then I would recommend notifying DREDF or Disability Rights California or myself at Independent Living Resource Center, San Francisco. So now I want to move into visitation. I know in the chat there was a question about visitation. So hospitals have updated their visitation policies during COVID, in making it in most cases that patients cannot have visitors. However, these policies should carve out exceptions for disabled people. The exception would be that if you're a person who needs a support person to help you in a hospital situation. So for instance, if you're a person that needs a support person in order to communicate so that you can access the hospital in the same way that someone who is not disabled can access the hospital, then you have a right to have your support person. This right is given to us under the ADA and other state and federal laws, which require accommodations for people with disabilities. And so California did issue guidelines also regarding the hospital visitations policies and carving out that if someone with a disability needs a support person, that support person be allowed in hospitals. However, as the same with the crisis care policies, each hospital has their own visitation policies. Now, many hospitals have very good visitation policies. For example, Kaiser has a visitation policy that does carve out the exception for disabled people to have a support person. It is very important that we recognize the difference between a support person that actually provides support versus a visitor, because visitors are not allowed. So you can find these policies also on many of the websites, or as well, if you can't find the policies, then calling the hospitals and asking what their support person policy is would be important. However, do keep in mind that many of the hospitals actually don't have a lot of training for their staff and employees regarding these policies. So in many cases, hospital staff don't actually realize that they need to allow support people in for disabled people. So in this instance, this is why I always recommend that you find the policy first and try to print it and take it with you. You can advocate for your own support person to be with you, or you can, your support person can advocate and let individuals know, or let hospital staff know that they provide support for you. I've had to advocate for individuals who have had a hard time getting in as a support person. And actually what was the most helpful was being able to show the hospital the California guidelines regarding this, and then actually show the hospital their own policy, and eventually being successful in getting the support person into the hospital to help the person, the disabled person. So if you have a hard time getting into a hospital and you need support yourself, please reach out to disability organizations, including ILRC SF or DREDF or Disability Rights California. And finally, I want to talk a little bit more about the vaccine. So I know that we just talked a lot about the vaccine earlier in this presentation. And as indicated earlier, the state does have guidelines regarding who should get the vaccine first. However, it's our understanding that also counties have their own task force and their own policies and procedures regarding who gets the vaccine. So, as I said earlier, the CDC, the federal government, issued guidelines last week that the vaccine should actually be given to all individuals 65 and over, and to people that are high risk of serious complications from COVID. However, California decided to only take half of this into consideration when reissuing their guidelines last week, and to only include people 65 and over, and to leave out people that are at high risk of serious complications from COVID. This was really troubling because this was done literally 2 days after they included veterinarians in category 1A. And as I said earlier, although we, really want our pets to get care and we have nothing against veterinarians, we believe, and I believe, that individuals that have been putting off medical care and individuals that are at high risk of serious complications from COVID should also be in category 1A. So in the work that I do with Fat Legal Advocacy Rights and Education Project and Nobody is Disposable Coalition, we actually created a community survey for advocacy purposes to find out more about stories of people who have had to delay healthcare because they're at high risk of developing problems from COVID or high risk of being discriminated against in a care rationing situation. So if you are one of these individuals that have been putting off care, or you know of someone that has, or you just want to help us advocate, please go to nobodyisdisposable.org and take the survey or repost the survey to your social media. We have over 450 responses, and we do plan on continuing to gather these stories and continuing to advocate with these stories for our communities to be moved up in the priority list of the vaccine. So thank you so much for your time, and I will send it back to Dawson.
Thank you so much, Brandy. For the second part with Brandy and John, we're going to do a shared Q&A at the end. So I'm going to pass the mic actually to Ligia again to introduce our next speaker, John, and then please queue for our collective questions and answers session for both Brandy's and Ziak and John's presentations at the end of not speaking. Okay, I'm going to stop. Ligia.
Thank you, Dawson. So we talking about this crisis, we cannot, ignore what is happening in the Latino community. We have John Jacobo that is going to be talking to us about what the Latino task force is doing with this health crisis, and also a little bit about the impact of the COVID on San Francisco Latinx community, and particularly on the Latinx seniors and people with disabilities, and what needs to happen to protect Latinx seniors and people with disabilities. I think that Jan is here with us, and so I'm gonna pass the mic to Jan. Jan?
Yeah, hola, buenas tardes. Hello, good afternoon. It's a pleasure to be here with you all. Maria, thank you for the invitation and having me come and speak a little bit about the work that we are doing here in community, for community and with community. So a little bit about, I think, maybe me a little bit, and then a little bit about the task force. So for those of you that don't know me, my name is John Jacobo, and I have since March now been one of the first members with the Latino Task Force, but have had the honor of chairing our health committee within the task force. Prior to this, really my life has been a lot of work around anti-gentrification, fighting displacement, and trying to bring issues of equity to the forefront for the mission community where I'm from and where I had the privilege of being born into. The Latino Task Force is something that came to exist only to respond to COVID-19. We recall back in March, the initial push and what we knew was going to happen was a lockdown where businesses would be closed, schools would be closed, and community understood that what that meant was a lot of pain for folks that are already living on the margins, folks that are barely surviving with the jobs they have. And so the two things that came to the forefront at that time were hunger, which we knew would become much more pervasive as people could not purchase the basic necessities to feed themselves and their families. And the second piece, in terms of bringing education online, is getting access to the internet and access to Chromebooks or laptops for kids to be able to navigate online learning and parents to be able to understand how to support. So the very first two committees that were born out of this Latino Task Force, which is 100% community-led, community-driven, and community implemented, were the Food Committee and the Education Committee. And the first two things we targeted were providing food to community and providing access to Wi-Fi and Chromebooks to students of San Francisco Unified School District. As you can imagine, that quickly morphed into what we have now kind of grown into. At this point in time, the Latino Task Force has 13 subcommittees or 13 committees that focus on things ranging from economic empowerment to small business, to, of course, health and food and education. And so all of this is led by volunteers in the community or folks like myself who are on loan from our nonprofits and have been what we call self-initiated disaster service workers. From the very beginning for us, we knew it was important to be out front and actually not be sheltered in place because a lot of our community does not always have access to the internet. And I think this is parallel to the same group we're talking to here. Not all things are as easy as creating a website with a bunch of links to be able to try to apply for services. It doesn't work that way. And when we're thinking of trying to fix problems, we have to be as inclusive in our approach as possible. So a lot of our work was focused around trying to be as inclusive as we can be and trying to target the communities that are most on the margins and closest to the pain. And so the health committee came about because we quickly started to realize that the social determinants of health, these inequities that exist in our country, exist in our society, were going to impact the health outcomes of COVID-19. The Bronx in New York was one of the first kind of flags that showed preliminary numbers of a disproportionate amount of impact with COVID-19 to the Latino community and to the Black community. And it was at that time that we began to think through, okay, how can we address this? The University of California, San Francisco simultaneously was sounding the alarms and saying, hey, 80% of the people that are sick in the hospital with COVID-19 are Latino and they are coming from the Mission District. And it was kind of that culmination of two groups that gave us the huge kind of, call it, testing capacity that we've been able to build out. So that is what the Latino Task Force, kind of how it started. And now what we're doing is kind of multifaceted. We are providing what started with about 500 boxes of food a week that we were providing to community. has quickly escalated to about 7,000 boxes of food that we are providing from the Latino Task Force Resource Hub on 19th in Alabama. We have in-person serviced a little over 7,000 community members, connecting them to programs like rental relief, helping them apply for unemployment, helping them apply for jobs, legal services, primary care connections for healthcare, a wide range of services that we've helped provide in person. And then of course, our testing, which we're currently doing. And so you'll pardon me, I've been running back and forth from our site currently on 24th and Mission. We developed a test to community care model where we provide testing, but more importantly, we provide the care component to people who need the services like food, cleaning supplies, connection to hotels, and connection to financial support through sheltering in place. And to date, we've done a little north of 30,000 tests in community in combination with DPH and UCSF. And again, we've serviced hundreds of individuals with our community care team model. And so we're very happy that now this is being enacted throughout the city and that other communities are also beginning to do the same thing that we're doing. Kind of the next thing is what is the impact and why has there been a particular focus on the Latino community? And what are some things for our senior community? So the first is, for those that don't know, there has been a disproportionate impact here in San Francisco. So the Latinos have made up 15% of the population, but at our peak, 55% of all cases, meaning we're 15 times more likely than any other ethnic group to have COVID-19, and we represented 24% of the deaths. So as you can imagine, the very stark difference of a lived experience for folks that are here. Our first project had two components that we baked into it. The first was in community testing and the care model that we've talked about, but the second was at-home testing for our homebound folks that are not able to get out and not able to come to a test site for numerous reasons. And going back to the point earlier of trying to be as inclusive as possible, that is something that we've tried to carry on with each of our projects. So currently with our project here on 24th Mission, we also have this home testing capacity for family members and individuals that cannot come to the site to get tested, but have come in contact. So we're constantly trying to push the ball and ensure that we're moving things as forward as we can so the city can follow and the city can provide these services, which are absolutely a function of a Department of Public Health. I lost my train of thought for the second piece that I was going to say. So I'll come back to that in a second, I promise. And the last piece here is just what needs to happen to protect our Latino seniors and people with disabilities. There has to be a twofold approach. We know vaccines are here. We know they've arrived. We know we've developed two, right? But we also know, the mayor just said today, that we're likely going to run out by Thursday of the vaccines we had until we get replenished. So that means that just because vaccines are here, it does not mean that testing can go away. And so what we have to do to protect our seniors, our folks with disabilities and individuals that are most on the margins, is providing services that cater to their particular needs. And what that means is ensuring that folks are able to shelter safely with dignity and have the things they need, but also have the ability to get tested should they have come into contact or suspect they have COVID-19, and have it be very low barrier and not cumbersome. Followed by, I think, the third rail, if you will, being ensuring that a vaccination rollout has the same level of competency for the communities that you're trying to target. It has to be kind of that threefold impact to ensure that we're protecting the most vulnerable and those most on the margins. And it has to be collective. We really do believe that these things cannot be top down as they have been in the past. When they are top down, meaning the city or the state, they don't work well. And they don't work well because, unfortunately, the city and the state don't understand the lived experiences and the complexities that come with those lived experiences. So they must rely on the experts. And the experts are us, those in the room that live these lives and understand those difficulties and are able to articulate them to get the results and the resources that are needed for our particular communities. So those are kind of some methods and some ideas. I hope I summed it up correctly or it made sense, but I'll be on for questions.
No, this is great, John. Can I ask you something? Because we know that this healthcare crisis presents in a different way now, but you know, Latinos and other people of color have been kind of, you know, suffering from our healthcare in the deficiencies, you know. So do you think that the Latino task force will continue after this, you know, crisis is over?
You know, I think to the first part of what you said, what COVID has really done is it has made the systemic issues caused by the racist policies of the past that have given us the inequities. It has truly made it undeniable that these racist policies are being enacted, and we are able to see that through the outcomes we have. And so the reason that there's a disproportionate impact with the Latino community is not because Latino community doesn't know how to wear masks or, you know, parties and doesn't follow the rules. No, it's because of the inequities. It's because our folks make under $50,000 a year in a neighborhood where a 2-bedroom was going for $4,600 a month. It comes from the fact that they have to work many jobs to be able to survive, in addition to having to live with many people in order to make rent. I mean, you're talking about cases where we found people that are living 30 people to a 3-bedroom. You're talking 15 people to a 1-bedroom. I mean, these are the conditions that people are sacrificing to be able to survive and thrive in one of the richest cities in the country, in one of the wealthiest countries in the world. And that's not just because it was an accident, but it's been the unfortunate legacy of these policies. And so I think we are now able to fully say that here's the white paper we can write about these inequities and why they exist. It is undeniable. And so to the second part of what you've said, I truly believe that we are having an awakening here in our country in general, from the massive demonstrations due to George Floyd being murdered and the Black Lives Matter movement, and this counter pendulum swing of, you know, the Proud Boys and the MAGA supporters. I think we're having a moment of reckoning as a country. And I hope that not just the Latino Task Force, but this mind state of how we're viewing society and the solutions that we need to get to solve continue on past this. And I do feel that the Latino Task Force will carry on, because unfortunately, as I mentioned, the vaccines, there's not a sufficient quantity, and we'll be needing to continue these testing sites for, honestly, I think a couple more years. So one way or another, I think this will be around. And I think, like many things, it will evolve into something that will continue to carry kind of this fight forward to try to make things truly equitable in this country. And that's my fingers crossed.
Thank you, Jan. Another question I have for you, and also please feel free to ask any questions to Brandy. You were talking a little bit about the stuff with seniors and people with disabilities. Do you have any needs that actions that we need to be taken for the Latinx seniors and people with disabilities? Anything that this group, we can start with this group, for instance, you know, what can we do? Or other people that, other community groups that we know that have seniors and people with disabilities that are organized, and people that will be benefiting from doing something. Do you have any?
Absolutely. I think I've become notorious in the city for having this personality of it's not good enough, right? Like, hey, we got the testing, it's going to come out your way. And I'm like, all right, great. We're a couple of months late and we still need thousands more, right? So the answer is it's never enough, whatever we have, right? Because this is one of the biggest kind of calamities we've had to deal with in over 100 years. So what I would say for this particular group, in a specific focus for our Latino elders and seniors and folks with disabilities, is to begin to ask the question of the city officials. This is both the mayor's office, this is the board of supervisors, this is the director of the Department of Public Health. What is the plan to vaccinate our Latino seniors and folks with disabilities? What are we going to do? How are we going to do it? And when do you presume we will begin, right? And we know, of course, that until we have enough vaccines, we truly can't do everything. But what I keep saying to anybody that will listen is that just because we don't have the vaccine does not mean we cannot set up the infrastructure to support when the vaccines arrive. And what we need to be doing yesterday is developing that network, that infrastructure, and understand exactly what will happen when you load in the vaccines. But it is not enough to just say, well, we don't have them yet, so we're kind of planning, we're talking through it. No, what is the plan? What are we doing? And when it arrives, how will we enact it rapidly? And that is really a thing that I think this group would be phenomenal and we'd be endeavored to you to lead on, is pressing and asking that question of how that will happen. Because if it comes from multiple directions, I think it will be something that will be heard loudly.
Thank you. I have a question for Brandy. And the question is, oh gosh, it's moving. It's alive. Hold on. How would you recommend for people to prepare to self-advocate for themselves when asking for presence of a support person? And what should they say if the nurse who doesn't know the guidelines argues that it's not allowed?
Hi, yeah, thank you for the question. So what I would say is the individual that needs the support person as well as the support person can advocate. The words that I recommend people say is that, I have a disability and I need a support person in order for me to access the hospital in ways that people that don't have a disability can access the hospital, and let the staff at the hospital know that there are guidelines from California Department of Public Health that state that disabled people have the right to have a support person with them. And also, if you have done the research ahead of time and you know that the hospital you're going to, such as Kaiser, has a policy that also allows people to have a support person, let them know that, they have their own policy. And you can also say, this is a reasonable accommodation. I'm covered under the ADA. And, as per this reasonable accommodation, I require a support person to assist me. If they still say no, there's different people you can talk to in the hospital. So you can talk to doctors. You can also talk to, the head of whoever's the head of the nurses. You can also talk to hospital administration, like social workers in the hospital. So for instance, some of the advocacy that I have done on this, I actually had to speak to multiple individuals in the hospital to make them understand that my client needed a support person. So you can talk to different people. And as I said, if that advocacy on your own still doesn't work, then feel free to reach out to disability groups. Myself at ILR-CSF, along with DREDF and Disability Rights California, are all advocating for individuals who need support people and that hospitals aren't, letting in. So yeah, feel free to reach out.
Amiga,
Thank you, Brandy.
in a second,
Go ahead, John.
Is it possible to go back to a point, something I missed and I just thought of?
Of course,
okay?
please do.
Leading to just connected to the advocacy. The other piece is that, and this is very important, and I think this is a perfect time to do it since we don't have enough vaccines. It is not enough to just do the vaccine dissemination. that definitely has to lag behind the culturally relevant and appropriate information dissemination. People have to feel confident and comfortable with what is being presented, and just presenting it is not enough. So part of that means ensuring that the city and the state are providing communication in a way that is readily available to our seniors and folks with disabilities, and in manners and forms that make sense and resonate, and that there are places where general basic questions can be asked so people can arrive at the decision that is most comfortable to them. So I just want to couple the advocacy points of information has to lead and the vaccine can follow.
Thank you so much. Thank you. I want to thank all the speakers for bringing their wisdom and sharing with us. And also we would like to, see in our community what the next steps are. So maybe, we can open the mic for some comments on the participants on what they feel is needed, and what as SDA we can do as an organization, and also as as a member-led organization. More importantly, what is our role here?
Right, and to make sure that our conversation is a little structured, I want us to take 3 minutes for us to think about what kind of COVID services do you wish existed now? 10 months into the pandemic, we probably know best what services we needed throughout this whole pandemic and in the future. So let's take 3 minutes, and please write in the chat or feel free to unmute yourselves and popcorn. So we hear about Medicare for all. That definitely would have made pandemic much easier for a lot of people, for everyone in the US.
Yeah, but we can start with our state.
Enforcing
Our city is doing a decent job, including everybody in healthy San Francisco, but we can, move forward to include all the state, something like that.
Carmet Road, enforcing mask wearing, that could have been a good thing to do early on, and giving out a lot of free masks for sure, that could have helped. Community outreach, Betty says, many people in Timberline without masks. Paid safe childcare, for sure.
Hey, I don't know where it says that it's coming from me, but someone hacked me. I didn't put that, but it's needed anyways.
Outreach about vaccine safety and importance, like everyone Richard said. Yeah, Medicare for all versus single payer, or just basically unified healthcare system. Yeah, kind of an intentional plan to right the wrong of racism in healthcare, not only just pushing the vaccine, right? And I think it all has to be part of a very big project in bettering healthcare for everyone, is addressing the wrongs of the past and wrongs of racism, and not criticizing the skepticism of people who were affected by it or whose ancestors have been affected by it, but pushing for that tragedy to not repeat again, like Tuskegee or in New York. Yeah, I wish we also had a Black speaker for sure. Yeah. I just want to also thank everyone. Please keep sharing your thoughts in the chat. Thank you so much for your caring and very on point responses about the services and different ways that the pandemic could have been approached early on. And even in the middle and even now, there's still hope for us to get better and feel better as a community. So for our next steps, I can just roll in, Ligia, if you don't mind. So for our next steps, please help us do a similar event like this in Alameda County. So if you're an Alameda County resident, please reach out to us, come to our next care rationing working group meeting next week on Tuesday. So that would be 26th of January from 3 p.m. to 4:30 p.m. on Tuesday. Come through, help plan this event, share information that's relevant for Alameda County residents, to Alameda County residents who are seniors and people with disabilities and higher weight people. So and a way to also continue to take action is to submit a comment to the California Vaccine Advisory Committee. So I put the information in the chat. What you can do is click on the link and send an email to COVID-19 Vaccine Outreach Committee. Their next meeting is Wednesday, January 21st. So next week, this week. Yeah, this week. So you can submit a comment about vaccine equity, or if you know of a community, if you're part of a community that you urgently and you're in a later tier, you can submit your comments right now.
And you can also become part of our group. So we have the care rationing meetings, and we meet every other Tuesday. And so our next meeting will be in February 2nd. And if you are and if you are interested on being part of our group and participate in planning this type of event, please feel free to contact us. I'm gonna put my email and Dawson's email in the chat so you can contact us directly, okay? Thank you.
Yeah, I just want to do a quick group poll of who is excited in making sure we get better healthcare for all, and who's excited to work with us on it. Can I see a show of faces or hands? Or yes, John, Ash, yeah, Maya, Veronica, thank you, Eileen. Yeah, I see lots of people who are excited about making sure we all have good healthcare and beyond this pandemic, right? So please come to our meeting next week. We'll send more information how to join through the email, but also send us an email to dihia@sdaction.org or dasam@sdaction.org, and we can send the information to you that way as well. And last but not least, we have a COVID-19 advocacy toolkit. for disability, aging, and higher weight communities. So please check it out, and you'll see a lot of important information about rates and advocacy, vaccination, all the information in there. So thank you for coming through. Thank you so much for our speakers. Thank you to Care Rationing Working Group for helping plan this meeting together.
Yeah, thank you. Thank you, everybody. Have a wonderful week. I mean, rest of the week.
All right, guys. Thank you all for being here and for inviting. I look forward to talking to you again.
Thank you. Thank you.
Bye. Adios.
Bye.
Thank you, everyone.
Adiós. Hasta pronto.
Bye-bye. Gracias.
Gracias. Hasta pronto. Vamos a tener más, ¿verdad? We're going to continue with this. So.
Claro que sí.
That's why we say hasta pronto. We're not going to say goodbye. And Madeline and Chubi also want to say hello. I don't know why. They always wanted to say.
Oh, hello.
Speaking of doing more of these, was there anyone who wants to help do one for Alameda County? Maya does, of course. It's awesome.
I'll help.
Good, like you will
Oh,
help.
Estelle.
Oh, Estelle wants to help. Yay.
Oh, Michael Lyon, he's from there. I mean,
Oh yeah, Michael's already helping. He might not know it yet.
All right.
This was
Should we
good.
end the meeting? Thank you so much to the captioner.
If you all want, we can move people to the waiting room and then we can do a quick debrief.
Yeah, that would be good. Oh my goodness.
Nice job. Wait, did
That
we
was
lose
nice.
Rhea?
Oh, did I put her into? Oh, she left. Should I
did.
move Alan back?
Sure.
Yeah. Oh,
You two are great.
Thank you.
Nice job. You did a great job of keeping it moving and asking good questions and getting a little bit of participation, but cutting it off when you needed to, like Sylvia.
yeah.
Yay.
I think it was good. I don't know, for some reason I couldn't focus with the language. I was just like
What do you mean?
moving to Spanish in some place. I was like,
Oh, yeah.
Oh, it was cute though.
That was good. That was good. Yeah. It was just a sentence or two. It was good.
yeah, I know, but I was just like, oh, I'm not. But I like that we were not feeling in a rush. You know,
Yeah.
I think that was a good thing. I do feel that the first part took a little bit longer than that it could have been a little bit, with Katie time. But I know some.
I was a little irritated that she had a whole presentation that I feel like she spent 10 minutes talking about stuff that was not at all with our questions. They asked for questions, right? So it was we didn't ask for a general presentation.
I know.
Yeah. Yeah.
Yeah, I know. I was just thinking, oh my God, why she didn't go straight to.
Exactly. When she got there, it was oh, here we go.
You sent her those questions to guide her, and yeah, but.
I mean, to be fair, I should have sent them earlier, but.
Oh,
okay.
It is what it is.
Yeah. That's enough time still. Yeah. She should have tailored it a little more. But it was also a hard.
And Brenda did. I mean, they went through.
Good job.
Thanks, Alan.
Thanks, Alan.
Good job, guys.
How are you, Alan? We cannot really see you.
Oh, you want to see me? You don't want to see me.
Why not?
There I am.
Hey,
You see what I mean? You don't
I love
wanna
your
see
hair.
me. I never got it together. Yeah.
Why
The whole
not?
vaccine-
I
the whole
look like you
vaccine thing
most
is
of the.
beyond a mess.
Oh. Hey,
I mean-
Alan, my hair looks like yours most of the time, but
Can
today.
I borrow your thing?
Yeah.
Can I borrow your thing? Okay. Yeah. No.
That's funny,
what's
Lee. I thought
emerged-
it was a hat.
I mean, I think the crisis care is really pretty. We've done about as good as we can. We've gone about as far as we can go.
Yeah.
There are guidelines. They're pretty good. They're posted by and large. But
Well,
the vaccine, I don't know what.
There's a few things on that, but we can talk about that later.
Yeah, but I don't think it. Compared to the vaccine thing, is beyond the pale in terms of inequity.
I know. So weird.
Getting well, no, I mean, it's beyond anything. I don't know how it could. I mean, there's no vaccine, and that's the main problem. But even if there was, getting it to people who really need it is going to be very hard or impossible given the current system.
Yeah. And that's just how it reflects all the problems that already exist that are gonna be related to COVID, but not really, existing because of COVID. They already existed. So.
Well, yes, if you're poor, if you're ill, if you're not belong to a large, I mean, people at Kaiser are getting, which is good for them, getting vaccinated apparently fairly readily, whereas
I haven't really checked what Betty sent, but I wanted to check, to see what kind of message I get, because Betty got something related to her own healthcare, right? So everybody have to get their own. I'm not sure how that works.
Everybody, from what I can tell, everybody in a system can then try and get it through their system. If you're not in a system, then you have no real way to get vaccine.
That's a problem because we
yeah.
still have a lot of undocumented seniors that don't have any kind of
documented people who don't have primary care physicians who are members of a network have no access at this point.
Yeah, they don't say it specifically. Like in Colombia, the president of Colombia said undocumented Venezuelans will not get vaccines. So here they don't say it, but then it's kind of the same thing.
There's no way for them to get it. And as she said, the vaccine is free. It's covered by your insurance.
Yeah, my parents are like, my parents and my grandma are saying like, America is saying they're only going to vaccinate like Americans first and then everyone else later.
That's for sure.
That's for sure, yeah.
If you look at,
so it's not even about
I sent an article around from the Atlantic, where our good friend Zeke Emmanuel made it clear that we should not share our vaccine with anyone until we've.
Bye, Jessica. I should go too. Bye, all.
Okay. All right. I got to go get lunch.
Yeah. Have a good lunch, Alan. Bye.
You too. Bye.
Great job, Licia. Bye.
Bye.